Presenting a case of male 52-year-old present with nasal obstruction, headache and snoring since last 6 months. Patient present with bilateral nasal obstruction that is progressive and headache more on left side and snoring since last 6 months. So this snoring also suggests of upper airway obstruction, and these symptoms are persistent despite medical management, including steroid sparing antibiotic. That obstruction is not resolved, and there is no history of epistaxis, anosmia, and facial swelling. On anti-rhinoscopy, there is septal spur on left side impinging on the middle turbinate, and bilateral inferior turbinate hypertrophy is there with congested nasal mucosa. So medication was given for the same and CT scan was prescribed. CT scan showing bilateral maxillary sinusitis, left-sided septal spur impinging on middle turbinate and bilateral inferior turbinate hypertrophy, and narrowed osteometal complex both sides. So diagnosis is chronic rhinosinusitis with deviated nasal septum on left side with septal spur with bilateral maxillary sinus mainly involvement and inferior turbinate hypertrophy on both sides. Associated sleep disorder breathing, that is snoring. Another component may be palatal and other obstruction. So patient underwent bilateral functional endoscopic sinus surgery was done, and you can see bilateral maxillary sinus ostium opening completely, and bilateral face was done. So there is obstruction of relief. OMC is cleared. Septal correction was done by removing the septal spur, and bilateral inferior turbinate reduction was done. You can see this bilateral maxillary enterostomy both side, and this suture is taken for the septal spur side, and this flap is reposited. You can see I usually take Bickel 30 so that it will be stabilized by this Bickel 30. So this is a case of nasal obstruction with Sluder's neuralgia with this terminate hypertrophy.